We will now move to our research presentation. Again, I will ask Interim Vice President for Research, Doug Gage, to present our speaker.
Thank you, President Stanley. It's my great honor to present our outstanding faculty before the board and allow them a chance to really describe some of the excellent work that's going on campus. Joining us today is Dr. Stacey Missmer. She is a professor in obstetrics, gynecology, and reproductive biology at the MSU Grand Rapids Research Center, with an additional appointment in epidemiology and biostatistics. She also serves as an adjunct professor in epidemiology at the Harvard T.H. Chan School of Public Health and a lecturer in pediatrics at Harvard Medical School. Dr. Missmer was recruited to MSU in 2016 under the Global Impact Initiative to focus on women's reproductive health research, our women's reproductive health research goal. Together with her colleagues, they have developed one of the top research centers in the country studying women's reproductive health. And I think this is a real testament to how targeted investment can really have a dramatic impact, and Dr. Missmer will describe that. She received her Master's and Doctor of Science degrees in epidemiology from Harvard University. In 2012, she co-founded the Boston Center for Endometriosis, which she is the scientific director, and World Endometriosis Research Foundation. She is really the author of more than 300 scientific publications. She is the immediate past chair of the American Society for Reproductive Medicine Endometriosis Special Interest Group, international advisor to the European Society for Human Reproduction and Embryology and Endometriosis and Endometrial Disorders, SIG. She's the inaugural field editor of Frontiers in Reproductive Health and the president-elect of the World Endometriosis Society. Please welcome Dr. Missmer.
Thank you for that lovely introduction, Dr. Gage. It's a privilege to be with all of you today. I'm going to talk very briefly with you about reproductive sciences here at MSU. So reproductive health encompasses the organs of the reproductive system, but also reproductive endocrinology, and really impacts the entire systems of the human body, not just gynecology and pregnancy, and has impacts all across the life course, from pregnancy and utero development, puberty, adulthood, maturation, through the menopausal transition. And it's also the key area of science linking multi-generational health. While reproductive health is not interchangeable with women's health, it's certainly a critical element across the entire life course. And our faculty here in the Department of Obstetrics, Gynecology, and Reproductive Biology contribute to all aspects of the life course. We have an exceptional faculty dedicated through bench studies of genetics and cells, all the way through individual health and public health and community intervention. This excellence among my colleagues has had many deliverables, not the least of which is that we are ranked 5th in the country for NIH funding in OBGYN, bringing in nearly $10 million just last year alone. I've been very proud to contribute to this success with my research and primarily focusing on endometriosis. Now, endometriosis is a condition where the lining of the uterus that is normally responds to the cues of the menstrual cycle grows and thrives outside of the uterus. It still responds to these hormonal cues, so it builds up and sloughs off, resulting in scarring, adhesion, about a 30% risk of infertility, and about 2/3 of women with endometriosis experience chronic pelvic pain that can often be debilitating. This condition affects 1 in 10 women, 200 million women worldwide, and has an annual cost in the US of $70 billion, which is on par with many better known and better focused upon conditions like diabetes. Our team has led quite a bit of the discovery around endometriosis as a high-risk group of women for longer-term conditions like ovarian cancer, autoimmune diseases, and in particular cardiovascular disease. There are several major obstacles, including that currently diagnosis definitively requires surgery. We don't really understand the causes, and that makes designing appropriate treatments and prevention difficult. And in fact, treatment is inadequate for many women with symptom recurrence in about 60%. There are so many questions to answer across all aspects of biology and also environmental and modifiable risk factor influences, including that we see a lot of heterogeneity in what women with endometriosis experience, what their condition looks like. And so again, I'm very proud that I lead with my team 14 current grant-funded grant awards across several funders, and we very much embrace national and international collaborations that have been very fruitful. I'm going to spend the rest of my time talking to you about one specific challenge in endometriosis that we're addressing in the state of Michigan. Many primary care physicians have inadequate knowledge about the disease. The symptoms aren't specific. As I already said, it's difficult to diagnose. Often symptoms are dismissed as normal aspects of menstruation and pelvic pain. And in fact, there's quite a lot of stigma around menstruation and menstrual health. 1 in 5 women report that they don't feel comfortable talking about menstruation with their healthcare provider. And 2/3 of teens report that they believe that we are taught to be ashamed about menstrual periods and reproductive health. This all culminates in part in why there is a 7-year time on average to diagnosis, during which in their journey, women experience about 2/3 have at least one misdiagnosis and half see 5 or more clinicians. So this has a large impact on the healthcare system and healthcare economics as well as individual health. Now, these data all come from those who have been successfully diagnosed, and we know that there is this pathway through to surgical diagnosis. However, there are several other paths of experience of women with endometriosis, whether they remain silent, whether they are not accurately accessing and having responses from the healthcare system, whether they have that incorrect diagnosis. We don't know how many women this encompasses, and we also don't know if their characteristics and their biology differ from what we currently define as endometriosis as we explore for better diagnostics and treatments. And so we've launched the WERP study, Women's Outcomes Research and Knowledge, here at MSU, that's designed to enroll a cohort of 1,000 participants among adolescents and young adults who are experiencing pelvic pain to better capture their journey and diversity of biology and interaction with the health system. We're engaging with partners all across MSU. It's one of the very wonderful richness of our university across the clerkships, the extension program, and also engaging with our partners across the state for especially engaging into this cohort underrepresented populations. Now, of course, the COVID pandemic has had an impact. We launched enrollment in February 2020, just before we had to stop direct in-person access. And so to date, I'm so proud of my team that has currently enrolled about 1/3 of our goal, just under 200 or 300 participants. As you can see on the map of Michigan, we are getting diversity of geographic region with at least 1 participant in each of the highlighted areas. But we have quite a lot of work to do, and we're working with our partners in Flint and Detroit and across the state and in the UP to enhance representation for this work. Also, speaking of the pandemic, we're currently developing aims and collecting new data and seeking funding around the impact of COVID-19 specifically on gynecologic health. We have some preliminary data that suggests that those with endometriosis and chronic pelvic pain actually have a greater risk and potentially greater severity of COVID-19 disease. They may also have an impaired immune response, so less of immunity success from vaccination. And we also know that almost everyone has experienced increased stress through many different stressors. And we have evidence that that increased stress is having a direct impact on the frequency and severity of pelvic pain. So many, many questions to answer. It's a wonderful area to work in, very multidisciplinary. And it reminds me of a pillar of epidemiology, Gina Stein, and reminding us that we need courage and persistence and energy because the answers aren't obvious or easy, but that's what makes this work so fulfilling and fun, and also what really highlights the excellence of my colleagues here at MSU. So thank you for your time and attention.
Thank you so much. I'm going to jump in with just two quick questions if I can. So
Absolutely.
first of all, kind of a clinical one. Seems like one of the challenges obviously is actual visualization and diagnosis of the condition. And my question is, are there any isotopes that have been developed or specific monoclonal antibodies that would allow you to get beyond ultrasound or CT or MRI or any of those things in making diagnoses?
So there have not. There are two subtypes of endometriosis that are successfully diagnosed. Those that involve the ovaries, those that involve deep endometriosis that can be seen on MRI and ultrasound. But that truly is the next batch. And I know Anna Moore and teams here at MSU are working on that quite actively, because that certainly should be the next leap forward.
It makes sense in terms of a radionucleotide approach. It just makes total sense. And the second thing is just, I'm really excited to see and how you talked about the partnerships we have at MSU, and of course the power of extension reaching out. Have you been in contact with the Henry Ford folks yet, or is that on the agenda to talk to them about?
We have. We're engaging with both those who are active practitioners treating patients with endometriosis. And again, we're also trying to make sure that we're engaging in that primary care setting to try to capture patients very early in their journey to both speed that along and get them to successful treatment more rapidly.
Thank you. Any questions from anyone else? Board? I'll just say that, we sometimes throw the term around world expert in something, a world's expert in something. After hearing your credentials, I'm willing to say we have one of the world's experts essentially in the area around endometriosis at Michigan State University. So thank you so much again for acquainting us with your work. Very, very impressive. And we're so glad you're here.
Thank you. It's an honor to be here. Thank you very much.
Thank you.